Beautiful. Well, folks, we are back. And as always, I try and leave the sleeves down, but the second we start, for some reason, way more comfortable to put these suckers up. But how we doing? It's again been a minute since I've been on here doing a lot of back end stuff, but we're getting up and rolling. Appointments are all ready. Um, we got appointments available. We got the first health talk that I do was completed inside of New Jersey yesterday. So we did a nice inflammation talk for the people here of New Jersey, the New Jerseyans. Also, burnt some of my eyelash yesterday, so that's kind of cool. I was basically filling up a furnace, and a huge thing of heat came and just burnt part of my freaking eyelash right off there. It's kind of funny. And then today, I actually had my first. I'm just kind of filling the air before the questions come in. I had my first do not redeem encounter. If you guys don't know what that is, I was basically selling a bicycle on Facebook because it's just taking up space. Never ever use it. And I'm like talking to this person on Facebook last night. They're like responded, normal stuff, right? It looks like a mom in the picture. Everything's in the ordinary for this period of time. And then today, she's like, "Oh, do you use Zelle?" I was like, "Yep. Here's my info to send Zelle and stuff." And then she's like, "Oh, it looks like it didn't go through. Can you help me here?" And then I was like, "Yeah, I got an email from Zelle that the payment was on hold and that I needed to send her $500." And I was like, "What?" And then she's like, here's their phone number. Get on the phone with them." And it's this guy that is like trying to convince me to give my banking info away. And I'm like, "What?" And he's like, share your screen, go to Cash App." And I'm like, "Dude, what does Zelle have to do with Cash App?" And then I just trolled him the whole rest of the time. I was like, "Excuse me, sir. How stupid do you think I am here? What the frick does Cash App have to do with Zelle?" And it was all a fake stuff. Yeah, exactly. Red flags up. Just funny thing that happened. That was today, actually. I was like, I'm sitting upstairs, like, what the hell is going on here? But aside from that, in terms of actual office stuff, we are getting underway here. Painting is almost complete, so that's pretty cool. Doing a bunch of orders and things for more furniture and stuff like that. But she's coming right along. I'm, you know, trying to get myself to make a stupid little like carousel video that all these chicks do on social media and put like a song with it just to make kind of a cool painting video and stuff. But yeah, it's looking beautiful. And we'll do before and afters, of course, right? Gotta have the before and afters. But Nas popping in here. Of course, we got Lane, Addie, ankle all bruised up. Oh my goodness. What the heck happened there? Pain's a signal. Please listen to it. I'm sick and tired of athletes asking me, "How do I get back on the field?" It's like, well, your body's trying to tell you not to so that it can heal, right? Just a different perspective on things, as usual. Because honestly, if you sprain your ankle, why are you trying to stop the healing process? Why are you trying to get back to doing activities when your body's clearly putting you on the couch for a reason? Saying, "Hey, there's damaged tissue here. If you keep walking on this, or if you take a bunch of Advil to relieve that pain, you're still doing damage to the area, even though you can't feel the pain." And there's some things that change with the healing process there and stuff. Um, but yeah, get that ankle up. Maybe depending on how bad it is, don't even compress it. Let that inflammation come and do its job, which is kind of crazy because usually I'm ranting on about how inflammation is terrible and all this stuff, but it's bad when it's a constant chronic response to the same thing over and over. And now your body's losing resources because it's constantly getting deployed to, certain areas to do things. But okay, wait, my stupid screen threw me this way. Okay. Oh shoot, I got stepped and cleated by another player. I remember that happening once. It was terrible. Those are never fun. Okay, wait. Let me pull the chats up on here. It's just easier to track that way, you know? But, and we got sound on. Unprepared, right? Okay. Mm-mm. I did not realize tapering off Lexapro would destroy my gut. I had terrible acid reflux that you never had, skin issues, rising. These meds should be. I've not had. Should be, and then it cut off. But my goodness, Lane, that's crazy. that's that's certainly something that can happen because medications change every system of the body. Just like eating a freaking strawberry will change every system of the body, or smashing your toe will do the same thing. So, yeah, there's body wide effects with anything that you do, as little as sleeping. So, not that sleeping is little, but anyways, okay. I keep going to MDs for my issues, but they never get down to the root. Okay, Miss Rudes, like I can't see when I close my eyes. So much for the lead up there. At least I got a kick out of it. Usually YouTube's the one making me laugh, honestly. But it's been a minute since I've been on here. I've been doing so much other crap. It's kind of weird. I'm like, what the hell? Why am I not going live? It's been way too long. Laura Bolt popping in there. Drop it off now says, you're completely unqualified to be talking about any of this. Okay. I don't do meds. I don't do surgery. Those are out of my scope. Food, lifestyle, supplementation, running labs, all within my scope. Those things change every system of the body. It's all connected. And yeah, it's kind of getting annoying dealing with this same dumbasses on here every day, but we'll keep going. The show must go on. What if my knee is red and bruised? Okay. If it's worse now than what it was the last time we were on here, then you're probably going to need some medical intervention here, and maybe possible meniscal surgery, or be put on certain protocols and things to get that acute injury to calm down. So that's a clear, moment where we do have to use medicine here, and there's definitely benefits to physical therapy and stuff. I think you were already starting to do that, but okay, my husband. Okay, wow, Zara, interesting. Telling people when they need surgery. No, it's that they will have to see a medical provider and get a workup from there. Jump into conclusions. If this is a dude, where's your estrogen levels? Or estrogens? Your estrogens are probably like freaking estradiol's probably like 60 on you. Anyways, how do I get a VAD and a large fry? Nice. We got the douches coming in. Why does every B complex have too much B6? They're probably trying to cover for deficiencies there. And if somebody's been deficient for a very long time, B vitamins are really quickly metabolized out of the system. So it's probably just to maintain somewhat of a sufficient level there. How do you know if you need crutches for your knee? This is where I would go and see somebody physically. I know that you've been working with an athletic trainer, which is great. I would just want them to double check the ligament structures of the knee there and do a few meniscal tests so that you can get a better idea as to if there's some serious injury to the area, because it's been a couple weeks now and it's just not sounding like you're headed in the right direction, which means we gotta change course there. So I'll go from the ATs to the PTs, and then maybe even an orthopedist so that they can work that up properly. Nothing more douchey than scamming vulnerable customers. These vulnerable customers or failed after fucking decades of seeing medical providers. That's the only reason why I have patients on my schedule. Because if you guys did the work here, I wouldn't have patients on my schedule. So, anyways, we do totally different things. You're, you know, well, not you. I have no idea. These are probably fake accounts in the first place. People that are too afraid to put their own name in the account there. But yeah, it's different things. Medicines to give medications, do surgeries, and then you have what we do for food, lifestyle, supplementation, and all those things. So, why is this not scrolling? Mm, okay. What did Miss Addie say here? That is what I did with an athletic trainer. We did meniscus test. I was in so much pain. Okay, you probably have a meniscal injury. I think you should go and see probably an orthopedist and have them work you up properly because we may need surgery here. But yes. Okay. That is what, okay. I have post gallbladder removal syndrome. Will it ever heal? 39 years old. So, perfect example. Had an organ taken out, had an organ removed because of dysfunction that was occurring in the body. Um, really trouble producing and stimulating proper bile, and then getting that buildup of stones within the gallbladder. And when you're at that point and it's super painful, yeah, you're probably going to need an intervention there. I would just wonder if they told you what to do with food the rest of your life. Because very rare, I've never had somebody say, yes, they've told me exactly what to do and how to rebuild my body after this situation. But you want to be doing some form of bile salts or ox bile so that you can now emulsify those fats and actually get good fatty acids from the foods that you are eating and put those to good use and build things like hormones and repair joint tissues and do all these great things that you need fat for. So I would at the very least be doing, we call ours gallbladder cooks, but some form of ox bile that is clean from a good source, and then probably a Genova test on top of that. And now we can work on the rebuilding aspect of that for not just breakdown and absorption of nutrients, but the microbiome itself. What's the popularity of good versus opportunistic infections, or even lack of beneficial bacteria there? And you can have things like fungal overgrowths, bacterial, or even I've seen parasites a bunch of times. So it's not every time the people on the ivermectin train. So okay, Jocelyn Nicole, hello. Hello. Why didn't you... I didn't see your question there, Lane. What is my specialty? Health restoration and chiropractic. This field was created by a guy who couldn't finish DO school. DOs don't adjust. They claim that they've learned some of that. So, yeah, it's not the same thing. The philosophy of what I do is to reduce stress, to reduce mental, chemical, and physical stress. If you don't like that, go and get your freaking boosters. I don't give a shit. Anyways, food issues, dietitian, Karowich. All right, this dude's getting disruptive here. What's your estrogen levels, man? This dude's freaking too afraid to put his name in there and everything. All right. Oh no, we got onto the bad side of TikTok. M8. Got a profile of humping a dude on there. It's gross. Let's see what comes out of this coming from MG. Bum, bum, bum. But after the meniscus test, he still made me go on, and I was in pain the whole game. Yes, because you should not be playing. Tiger Woods' knee. Oh, I thought that was in response to Addie's thing. All right, I think we got through most of the BS on here. Should be pretty good now. There's always some beginning backlash. What did I do today? I've been fighting back. You gotta defend the castle. You can't just take it, right? Especially when it's from fake accounts. Boki, what's going on? It's just a different perspective on health. You are in America. You have the freedom to choose what the F to do with your own body, right? If you want to take pills the rest of your life, if you want to get every booster, go ahead. Or you could go to thewellnessway.com and check out the vaccine database that we are building with every single condition associated with every single vaccine. Check that out. Pretty freaking cool. I've been sending that like crazy. Um, if you just wellnessway.com or thewellnessway.com, click resources and then research database or whatever, and then go on there and be amazed. There's an A to Z list of every single condition that they're basically linked up with. So Tiger Woods' knee. I know. I've been telling Addie she's got to go to. We may have a little meniscal tear in there, and the swelling and all of what we're hearing seems to be like it's not getting better. We're still red. We're still swollen. The athletic trainer did a couple orthopedic tests on the knee, special tests or physically things there. No imaging, nothing like that yet, but we definitely want to do that. We want to go to an ortho and get a proper workup. Addie's getting all the attention today. Oh, my ankle is so bad. My goodness. Yeah, I agree. Tiger Woods' knee. This is a medical moment, and we definitely need a workup here. So that is what it's for. Either way, what's popping? Now that we're through the little shitstorm in the beginning, um, how are you guys doing? Okay, we got another knee comment. Had one new knee. Don't want to go through it again. Is there any relief out there? So there's things that you could do chemically too, and it's getting inflammatory responses to calm down. I mean, something like arthritis is inflammation of a joint. Arthritis, arthritis, inflammation, joint, inflammation of the joint. So what's causing that inflammation? Usually, sugar's a huge piece to it. A lot of other foods that we could typically be encountering there, or other forms of toxicity too. And now your immune responses keep getting like crazy, creating a chronic inflammatory response over and over. Great things for joint tissue themselves: turmeric, boswellia, vitamin D is going to be high enough. Aside from that, though, we should be doing some labs to figure out inside chemically what we need to do to get these responses to calm down. But extremely common, and I would at least go to a chiro or somebody that you can go and have the joints there physically tended to and just get good mobilization of those things. And then obviously retraining weight bearing exercises to what you can, tolerate there. Do not muscle through pain. Pain is a signal that something's wrong. Do not muscle through pain. But yeah, you want to make sure you're stimulating the muscles around those different joints that are hurting, be getting inflammation down, getting rid of the, dairy sources, wheat, all those excess starches and all those things that hold a bunch of water and don't do you good. So first step, yeah, right after. Okay, wait, Addie, I pretty much lost all the muscle on my left. Exactly, that's going to happen when you have a serious injury like that because you're not activating those muscles anymore. First step is to see the ortho since things can go wrong 100%. Second is PT or good chiro, just somebody that's going to rehabilitate things. But yeah. Did shots brace everything on bone on bone? Oh my goodness. Guess I'm stuck. Oof. Dang. That is a tough place to be. Um, I just came to mind too. Bone broth proteins, like ancient nutrition, has a great source of those things. But there's a lot that can happen when your labs are off. When you have low vitamin D, high sugars, liver enzymes that are creeping up, and inflammatory markers that are saying, "Hey, we got to calm some of this down." There's things coming into the system, whether it's through air on your skin, foods, and things. We got to get these responses to calm down. For joint mobilization, go to a physical therapist. I would disagree there just because chiropractors are pretty much all they do physically is to mobilize joints. So from grade 1 through grade 5, and that is basically what we do. There's some that will specialize in the rehabilitative portion of this, but I think PTs take the crown in terms of rehabilitation by far. 6 or later tonight before practice about the knee. No ortho is going. Oh wait, I skipped one. I have severe exocrine pancreatic insufficiency. Took 10 years for diagnosis. Holy mackerel. Good diet, micronutrient supplementation saved my life along with pancreatic enzyme replacement therapy. 100%. We're going to need a ton of um, support there, not just for the things enzymatically, but other constituents that can help out pancreas. Some of my personal favorites: gymnema, um, Oregon grape, and probably blood sugar glandular or some glandular with pancreas tissue in there, because you're literally getting the same enzymes that make up pancreatic tissue, just in really small amounts. So, pretty much your best multivitamin for somebody going through that. And on top of that, I would want to see stool test, which I know is not fun to do, but something like a Genova stool test will show us how to now rebuild and just set you up the best way possible for the future. But I love what you're doing currently, and if you need help, kind of tightening things up, let me know. Shoot, keep banging the camera. What else is new? No ortho is going to leave you bone on bone unless things are very old. Get a better ortho. Look at that. Tiger Woods' knee coming in to save the day. Love it. Hmm. How to kill Klebsiella pneumonia. So this is an opportunistic infection in the GI, and that is the wrong way of thinking. That is like the functional medicine way of thinking, which is, okay, we run this lab, we see this marker, now you have this supplement. It's like, no. Well, what barrier dysfunction and what things that got toppled over led to that infection to take place? Because it's opportunistic. So what opportunity led for that infection to take over? Because if you do all the good digestive bitters, okay, great, but what's going to happen again? Those those things will come back, or there'll be another very similar infection that will take over. So your best bet is to do, well, you've already done a Genova test, so I would want to see that Genova test, or whatever test you had run that or showed you the. Sorry, my phone's ringing. That showed you the Klebsiella, and then from there, can you do some good things with like chamomile, colostrum, shaga mushroom, Oregon grape is like a good start, but I would want to see the whole lab there. And now knowing exactly what we need to do to basically rebuild that GI barrier so that that doesn't come back. And obviously, cutting your sugars down is going to help a lot. Getting fiber up like crazy, for crying out loud. What else? It's hard to know without seeing the lab, but you have the name of the infection, so I would want to see the rest. Yeah, can I ask for some advice? Yes. Elliot, I don't know who that is. I have extreme fatigue, muscle pain, insomnia, and heart palpitations. Okay. Um, guys, I'm seeing this in a couple questions here. Medical advice is about medications or surgery. Okay. A freaking mom on Instagram can talk about lifestyle. You don't need a degree to talk about lifestyle. Yes, that is true. The dietary things, supplementation, Um, Running labs, all that stuff is literally within the scope here of what I do every day. If it wasn't allowed, I wouldn't be allowed to do this. I wouldn't be allowed to have the clinic that I own and all this stuff. So, yeah, this is like freaking arguing with dumbasses on here. Anyways, why is it TikTok that's full with like the most brain dead things? Freaking, I gotta get some. Okay, where were we? Extreme fatigue, muscle pain, insomnia, heart palpitations. I wonder if you're. What are you doing so far? What has worked? What hasn't worked? And there's something either hormonally going on here, explaining more of the fatigue side of things, the insomnia. The heart palpitations, though, this can be a deficiency, and commonly potassium, commonly sodium, and things that are going to excite the body and lead to those deficiencies to happen because your body's trying to get things out. So either not enough's coming in food wise, and we're getting deficient in some aspects, or we're highly inflamed, and now your body's using all that resource and getting rid of things, or both, which is really common. In some cases, there can be a viral infection that has resurfaced and lead to very similar things like that. I wonder what your COVID vaccination history looks like because that is directly tied to some of those things, and we can run those antibodies and see what's happening there. So, um, yeah, that that can definitely be dealt with. Honestly, I would want to start with some blood work, start there, and figure out what areas we need to poke little fishing rods into, whether that be testing you for food, testing the GI, testing for viral things, testing for mold, all these different routes that we can go in. And that initial blood lab will show us what to do. And if you already have some labs already, that is perfect. Send me a message, let me know. You could be the brother from RJ Mute. Perfect next Halloween outfit. I've never heard of that. RJ Might has Steppe Pontiac Bulgarian phenotype. That is hilarious. YouTube is so funny, dude. People on here are so funny. Okay. My daughter has a lot of phlegm, constant throat clearing all day and all night while sleeping. So with kids, depending on the age here, there's definitely some foods that she's interacting with. Both myself, my family members, friends, and a ton of different patients. When you get food allergies run and start eliminating those things, and it's not forever, and especially when you repair the GI, they change and they go down and all these good things happen. But when you're constantly allergic to something in a delayed response, you're going to get that phlegmy throat and the after every time you eat. You can do something like OSHA, which will help dry the sinus and lungs a little bit more. But probably OSHA and Albizia right now, as you order that food allergy test and get some answers here, because there's definitely some thoughts on vitamin D and things, which could totally be true. But yeah, but I also have a hairline fracture on my skull. Oh my goodness, what the heck? What will happen after my surgery? I have no idea. I have no idea. I don't perform surgeries. Not the right guy to ask that question for. Bum bum bum. My daughter. Okay, she's the one with those bacteria, Klebsiella, pneumonia, and Citrobacter. Okay, I want to see the lab there because there can be an issue with mold in the house here. I would want to, because of Klebsiella pneumonia specifically and Citrobacter, I would want to ask a couple questions on mold itself, um, because that's definitely what's or could be happening here. I've seen that situation a bunch, and even if you're seeing things like eczema, um, or other skin type of issues starting to show surface, the body's trying to get rid of toxicity, so that's coming out through the skin. So, um, then at that point, it's like, okay, if it is more of an issue with mold, now we have an immunosuppressive effect on that, and we're dealing with a fungal issue, not a bacterial thing. And I mean, there's still some bacterial things at play here, but all right, we got another dumbass in here. Stick to cracking backs, people, or whatever. There's mental, chemical, and physical stress to what I do, so don't come on here acting like you know something. And then we love an insane amount of unnecessary testing. The testing that I run is the testing that doctors don't do, and that's why my schedule is full of patients because regular docs don't run these things, so they come to other people. You know, if you were doing the things that you needed to do for these patients, they wouldn't be in my office. Pretty simple. But you don't do that. That's not the way it's written. That's not the way your protocol book has taught you what to do. Unfortunately, it is patient comes in, this is a set of symptoms or a thing that's wrong on a lab. Here's your book to tell them what to take and how long until it gets better or until they have a reaction and we need to switch things up. A freaking third grader could do that. Freaking jacking me up here tonight. Anyways, so let's get back to Earth here. I have, okay, wait. We talked about the GI there. For username 192822291, send me a message. I want to see her lab. LBWV, I have HODVT. Oof. Suspected. Okay, autoimmune. That has lupus. Should I be tested? I would wonder what the game plan is to get you back to normal and to get these immune responses back to normal. That's by figuring out the triggers. So, what labs have been ran? Um, is it good to look and screen for certain diagnoses? Sure. Does that tell me what to do? No. A diagnosis does not tell me what to do. It's really about the individual, and this is all individualized care on this live here. So, whatever that individual is going through, based on their sets of symptoms, we need to figure out why those things are happening and what the patient can do to get those things to normalize. Because I don't have a magic supplement for these things. Um, for more of the concerns with the blood vessels there, you can do some K2, some potassium, things like that, but you're definitely being tended to medically, or at least I would want you to, until we figure out what needs to be done here. But you can do that test. I would want you to get more functional tests done, but yeah. Can MCAS cause you to become allergic to other things that you weren't before? Certainly, you're having mast cells go crazy. So, the cells that create um, allergic responses are going buck wild because of certain triggers that are being excited or excited there. So now it's what are those triggers, and based on those certain pathways that are interacting with your body, that's the whole point of getting those labs done. Now you know what to support with different constituents there, depending on interleukin 6, interleukin 1, 1 beta, or whatever is going on there. How do I do a deep detox of the liver, kidneys, and gallbladder? Yeah, I mean, I my I don't like just jumping out of the gate with a detox. There are certain foods and things that you can aim towards, like on the Wellness Way website. There is a detox book on there if you want to kind of simulate things like that with food. But in terms of supplementation, that needs to be based off you and how we need to assist your body with detoxifying. So yeah, um, but you could definitely check out that book in the meantime. Even if I want to fix those two, it won't go away. She had H. pylori and pneumonia a year ago. Um, so the question being, what if you just attack those two opportunistic infections? No. You'll do a lot of bitters, essentially, is what you're going to be doing, which is one part of that. And it's now 2, getting that out of the system, and then 3, rebuilding, and then 4, retesting and seeing if all those things went away. But if it is that issue with mold, which I would bet you money that it's that issue, that's those 2 showing up like that. I there's no way it's not a mold type of issue. So that's just my 2 cents on it there. But if you keep living in that moldy environment and you just take a bunch of antifungals, I mean, you might even feel worse because now you're still in that environment and your body's trying to get it out quicker now that you're supporting things. So I would want to see the lab that she had run first, and then we can make a game plan from there. So, but yeah, just going after the infection side of things, which is probably frustrating for a lot of people because you're coming on a TikTok looking for the alternative stuff or whatever it be, and you're going to get quick answers from people, but this is a no BS live. So if there's something that's not true, we're talking about it if you haven't noticed, um, because there's a lot of things that are not true out there and a lot of people that are just trying to push supplements on you, and the whole goal is to get off of these supplements, right? But I realize the situation you're going through. I know the concerns that you've had. I've seen several kids with this, and even parasites to tag along with that too. But yes, is that your actual background or is that a green screen? This is my actual background. Pretty crazy. Oh my goodness. I have a lot of scrolling to do. Okay, finally caught up. Dang, man, you're hating on me? No, I'm not. I was supporting you. Tiger Woods' knee. You're saying good stuff. I swear. Oh no. YouTube. The YouTube channels sometimes are just crazy funny. Who is this? Demon Bunny Queen. Why, hello. That's funny. Um, uh, yeah, good stuff, hey? I never understood, for some reason, this is just me kind of going off on a tangent. TikTok's live actually looks great. YouTube's live quality is freaking booty. Not the good kind either. Like just straight not good at all. The lighting's terrible. I got 2 phones right here, and the YouTube one sucks, man. Anyways, thank you. God bless you. You're welcome. Was my MD education and 5 years residency not worth it? That's not true. It's definitely worth it. Um, my son is 15, 6'4", and is having a lot of pain in his left knee. Should I worry? This is a good question for Tiger Woods' knee because he's definitely going to know a lot about growth plates in there and things. Um, could you show us your hands? Hello? That's funny though. Hello. I was working outside, so they're not. No, they're pretty damn clean. Look at those things. Look at that. Psh. People are asking to see my hands. um, okay. Yeah, I would ask the Tiger Woods knee on here. Oh, he responded. Look at that. Okay, so he's tackling that one. I'm glad he's on here. ECG said possible left atrial enlargement, but feel fine. Can this be wrong? Yes. Please go back to those docs and make sure that everything's being done what needs to be done. And if you want to share those lives with me, just to get a what to be doing on the natural side of things, I would happily go over those things with you. But yes, I'm asking: does primary relative with lupus anticoagulant disorder increase my likelihood of the same? I'm not the right guy for this, honestly. That that is more of an MD type question. I'll be straight up with you guys. It's out of my wheelhouse. Um, They are cute. Thank you. Thank you very much. From the Demon Bunny Queen. That's funny. Bum, bum, bum. What else do we got here? Sorry, I'm getting sidetracked, people. Whoopsie daisy. Okay, let's get back to what we were doing here. Um, you kind of look like the guy from You, from Nosy. That's actually not the first time I've heard that. Um, what's his name? Evan Peters. That's a common one. Honestly, people say Evan Peters quite a bit. I don't know what you specialize in, but I have so much pain, like everywhere. Help. This is where massages come in huge, um, because pain is not just a signal there. It's there's so many things coming into contact there, from the physical stress that goes on chemically, things that go on, and mental stress too. When you guys are stressing out mentally, your boyfriend pissed you off, or your kids are driving you nuts, or your husband's annoying you, how do your shoulders feel? How does your back feel? Like all these muscles start to tighten up because just your mood went off. I mean, everything's connected. If I smash your freaking toe with a hammer, your heart rate changes, your blood pressure changes, every single system is going to respond. So it's really about figuring out the different stresses affecting your life there. There can be things that are inflammatory wise. Sugar's a huge one. Low vitamin D, a big one. Not getting enough of the essential fatty acids, the fibers and things that help your body heal and repair tissues like this. And proteins, my goodness, you ladies are snackers. You guys need to eat more protein like crazy, okay? Um, but yes, and honestly, I talking about the massage thing there. I I got a full, or not a full body one, but basically one that drapes over the shoulders, and you could use it on the low back too. My goodness, best $100 I ever spent. And we got Black Friday coming up with Cyber Monday and things. Just make sure you get a good brand, not like some, cheap thing. But you'd be surprised as to a 15-minute session with that thing, how much mental stress relief you get. And even doing, massages on the low back, you'll feel your bowels start to kick up, and maybe you have a few more bowel movements that day and things. So everything's connected. But yes, really low on vitamin D, definitely. Super common, especially with this time of year. You guys are funny, man. Um, you guys are crazy. Anyways, okay. Thank you for everything. Can I send you her labs? 100%. Just send me a message. I'll give you my email and everything. If you're in Florida, I'm in Ireland. That's so funny. Genova tests, see if you can help. Perfect. Genova tests are great. And you put you put a little fancy E on there. I wonder if that was by mistake or on purpose. I've always wondered what chiros think of orthos. I think they're freaking awesome, because what I can't do, you can. And once they pretty much get through, a surgical scenario, or in a, really rough acute scenario, it's kind of like, okay, what else could they do in the long term and things like that. But I think it's a synergistic relationship, and it's not, and maybe, there's some people that just have some weird stipulation on orthopedists, but I don't, not at all. That's Everybody has a specialty for a reason, and I don't think one doctor is better than another in terms of what area they work in. Um, Brain surgery, pretty, that might be the one where I kind of tip my definite hat off to, because it's like, goodness gracious, we could like replace a heart, replace a lung at this point. You can't replace a brain. Like brain surgery's got to be crazy. But anyways, going off on tangents again. Um, but yeah, I don't have anything against orthos. Okay, I feel like what I'm doing might need a little bit more of a push. Okay, yeah, I'd be curious for um, what's happening there in terms of other supplementation and foods that you're doing, because that test will show you what to be doing with foods too. Any thoughts on sciatica during pregnancy? Chiropractors are great here. Definitely something like Webster technique going to be huge for just helping the pelvis be nice and mobile. But it's when it gets too mobile that you start getting these types of issues. So there can be some pelvic floor rehabilitation that you can do just to help with um, even birth processes a little bit later on. And excuse me, helping with a lot of the pain that happens with the pelvis and with sciatica as a whole, because that has a lot to do with your pelvis. So, but getting adjusted, getting your massage on there, um, and honestly, find a chiro that is certified in Webster technique, and you will deliver that baby no problem. Mark my words. I got the new daycare job. I start Monday. Tweety, congratulations. Be complex is good for what? I think I give B vitamins in certain situations. So most of the time, what I'm going to be doing is going to be a whole food form in like an organ meat. So in the form of liver, or like for something like female glandular, for a cycling female, you get liver in there, you get ovarian tissue, you get some uterine tissue in there, and now you're getting a different complex of enzymes and constituents in there that your body's familiar with, for one, and knows what to do with those things. And they are the most bioavailable, nutrient dense things on the planet. So pretty good in terms of multivitamin. And then you can be kind of organ specific depending on what we're working on. But if it's trouble with the immune system and things, you could do something like an immune glandular. Um, but yeah, and that'll help out with any anemia, or I don't know, or age or anything like that. So that's going to be a little bit different. But B vitamins are kind of covering deficiencies. And if you're eating enough food and getting enough things from it that way, given that her GI is also under some stress here, so you may be not absorbing enough of the food that you're consuming, which may be good enough, but that can definitely be an issue. The YouTube comments are going crazy right now. We got some interesting stuff here. What was this last one? Pelvic floor rehab. That's right. Starting advance. Have a patient at a time. Who is this? Rakshini. Thank you very much. Look at you guys with your own little YouTube channels on here too. My goodness. How cool is that, huh? She seconds that one. Well, hey, I'm glad we can all agree. Ibuprofen versus beta blockers. I'm not your guy to ask in terms of meds. It's not my wheelhouse. I don't change people's meds, none of that. What sunscreen should I use? I have melanoma that runs in my family. Van Man is the best brand I know out there, the best, cleanest brand I know out there. Fantastic stuff. So, what am I drinking? I'm a little bit of espresso. I know it's kind of late, but I like a little nightcap of espresso, and then some Ultima electrolytes and lion's mane powder, actually. So pretty cool. But yeah, for the sunscreen, Van Man. Van Man, definitely your best bet. What about stomach problems? It depends on why they're happening. I think stomach acid gets low a lot of the times because people stress out like crazy. In the past 2 weeks, everybody on here has either not slept enough, went to bed too late, stressed out over something relationship wise or something else, right? And now that leads you to have lower amounts of stomach acid. And now you can't break down your foods. If it's, it depends on if it's more of the, you know, acid reflux side of things or bloating, that would kind of point us in some direction there. But I would want to talk to you more about what's going on here, for Kayla, and send me a message on there too. Is this Lyle Mendez? That is a new one. Lyle Mendez. I've never heard of that guy. Let's see. What the? that is not that is not accurate at all, man. This guy's scary. I'm not that scary. Goodness. What causes severe painful periods? It depends. It depends on why we're having that fibrocystic growth, depending on if it's more on the cyst side of things or more fibrous tissue that's growing. Iodine is extremely low in a lot of people. Uh, and iodine, just each breast is going to take 6 micrograms per day, or milligrams. I might be saying that wrong, but each breast is going to require 6 a day. So that's 12 right there, and most people are not even getting that enough. That also impacts the ovaries too, and your thyroid, and all those. And your thyroid interacts with your estrogens. It's all connected there too. The GI, though, do see a lot of people, even females that do not have any symptoms in the GI. They have yeast overgrown. They have bacterial things, and that inhibits you from getting rid of toxicity. Toxicity, including the estrogens that need to convert out of the body. So, yeah. Anyways, um, but yeah, and for the people that, um, but yeah, I'd be curious as to what's going on. What labs you've had done? What have you worked on already? Have you been to other docs? Because usually what happens is I have period pains. Okay, cool, birth control, and then 10, 15 years later, then we have either more problems or now you're infertile. Now we got other issues there too. So it depends on what's going on there. Um, but I would want you to do a full blood work of all of the estrogens, because estrogen's not a hormone. There's 3 different estrogens and 6 different metabolites that you need to look for. And then a Dutch complete test on top of that. And now we'll know production and conversion of those different things. And it just needs to be done at the right timing in your cycle, because if it's, uh, you know, before ovulation, things are going to be off. So I'd be curious to know what cycle timing even looks like. If you have an aura ring, that can give us a lot of insight into certain temperature regulations that's going to take place and show us where ovulation is. Um, but yeah, I've had tons of people say, okay, should I go to an OB? You definitely can. Definitely can go to an OB, get some diagnostics looked at, uh, maybe do some ultrasound and different techniques that they could look for, different grades of that tissue overgrowth. And typically that's going to be done or diagnosed through surgical things there, which again, not my wheelhouse, not something I do. Um, but yeah, if there's nothing showing up there or even minimal, now it's our wheelhouse. So, because not much is going to be done there typically. That's just what I see. Sorry, that was a really long um, thing there. See OBGYN, period's very painful, and advocates for themselves. Heck yeah. You got to look at your options available. I definitely want people to screen for if something is needed surgery wise. I hope there's not. And most of the time there isn't. But hey, if it's covered, if you can get that looked at, beautiful. And look at your options there. I just want to get complete testing on you because you want to figure out why this is happening. Okay. Mm-mm. I am. We cover the stomach problems. I have a fever, cough, flu. What are the symptoms? Well, you would know, right? They're going to show up differently for everybody. There's going to be some variation there. What's the best way to boost iron deficiency? stomach acid and getting whole food forms, the best forms of those things. I think things like, again, immune glandular is the one that we have, but there's spleen in there, there's liver in there, and demon bunny. Oh my goodness, that's you guys are crazy on here. You guys are crazy. Um, okay, best way for that deficiency, I think it might be due to a lot of antibiotics. Possibly, I don't know if that's really it. Maybe, hunger went down and certain liver things happened, and now you got rid of some of those. But stomach acid support and getting enough in. There can be situations in the GI where you do not absorb enough, and your stomach acid isn't high enough, so you can't break down those iron-rich foods. And now, guess what? You don't absorb them. So it's like I eat everything, and it can't stay in your stomach. Oof. Okay. So motility is very low, and again, stomach acid support there. Getting stressed down is going to help with motility as well. So I like things like chamomile here. I like something like betaine hydrochloride. I like something like Oregon grape just to simulate some bile there and help with getting a good bitter into the system. And chamomile's a good bitter too, but more just focusing on things neurologically that can happen with GABA and calm the whole system down there so you can get stressed down and remove some toxicity out and get some good signaling to the upper digestive tract to just move some food boluses along there. But yeah, okay. Going to see a GI doc Monday. I even got sharp pain. That was supposed to be an exclamation point. Okay. Well, I'm curious to see what happens there. What do we got on YouTube? Oh my goodness, YouTube is blowing up. Okay, Doc, I have a question. Demon Bunny is so funny on here. Okay, Doc, I have a question. I used to have 4 teaspoons of instant coffee in the morning. Sorry, I used to have 4 teaspoons of instant coffee in the morning, and I feel super energetic, but at the end of the day, I get like a small anxiety attack. What is that? Mold, especially something like instant coffee, is extremely high. Or did I say mold? Coffee, especially something like instant coffee, is extremely high in mold. So find a mold-free brand. Equip Foods in the YouTube description there. Um, I have the brands there that I use, just clean things that you guys can go for. Um, there is Danger Coffee or Lineage is a good brand, but I like Equip Foods because it comes from the same place. It's the same third-party testing. Everything's clean, but it's like $10 a bag cheaper. So why would you get the stuff that's just a bigger brand so they can charge more, I guess? But how to boost liver enzymes? If they're low, that's typically going to be poor stimulation of bile and even um, yeah, probably a lot of the bile issue. And just thinking of the citrobacter and things there, if there's like a mycophenolic acid that shows up on a mold test for her, that is why the liver's so low in terms of those enzymes, because the mycophenolic acid type mold is going to slow that gallbladder down like crazy. These guys are funny. Gina, we could all hang out, right? How do I almost clicked the wrong button and made Gina a moderator on here. That's funny. Either way, um, everybody's welcome, even the haters. We actually made a friend today. Tiger Woods' name, pretty cool guy. I mean, from what you guys have seen. Um, Flacco meme channel. Let them do what they want. Lol. Malaysian. Oh my goodness. Oh, now everybody's fighting in the chat over on YouTube. Guys, this is a peaceful place. This is a place for hope. We're here to We're here to have a good time. Somehow it's already been an hour, which is freaking nuts to me. But, and for anybody on here that if I missed your question, send me an email. If you're on TikTok, you could just send me a direct message. If YouTube's listening, please make a message button so that people can message directly. I do keep my email in there on the YouTube page or in the description there on my channel, whatever. Anyways, let's hit the ground running here again. We covered the liver things. Yes, everything I eat. Go number 2, sharp pains. Kayla, that can be some gallbladder things going on here. Now that you mentioned that detail, as I say to everybody, well, let's let's see what the GI doc says on Monday. But I have some ideas for what you can do there. As I say to everybody, go to see a derm. It's cheap, not bad. Let the GI doc know that. Bum, bum, bum. Doc said it could be IBS. It could be. It's just with what you just described. We definitely want to help the gallbladder here a little bit. Hello, good evening. Hello, Miss Lenzenclaws. What do you think about dandelion tea? Dandelion root is not fully extractable through a water-soluble base, so you actually need an alcohol extract for those things. Okay, YouTube chats. Let's tend to some of these because they're going crazy. Gina, you said, oh my goodness. Guys, what are we doing here? True, not a man like you would be interested in such. Oh my goodness. What the heck? This is kind of funny though. Hey, we're good here. We're good, guys. Let's be friends. YouTube is they're throwing punches at each other. You guys are wild. Can I time out Gina? I'm not timing out anybody. We're letting the freaking seams fly off this damn thing. I'm laughing at everybody, Gina. We're not picking favorites here. We're having a good time, folks. Let's be nice. Let's be nice. No, we're having a good time. It's easy to get triggered online. Even today, I got triggered from people earlier. It's hard. Even I lose my cool. I try and keep my cool all the time, though. I do my best. I do my best. Don't be a Karen. Nobody's a Karen. All right. Well, either way, we're still having fun. That's all that matters. Okay. I went over my stool test. Crazy transition there. I went over my stool test and I have a big sign that I may have SIBO. It's expensive though. What do you mean? Do you mean the the plan is expensive or the options that you're getting? What do you mean by the expensive part? I mean, for SIBO, you definitely want to go low FODMAP at the very least so that you can have, just great dietary things coming in the system because you're going to really struggle with certain colors of foods too. A lot of the oranges, the yellows, the reds. But now it's figuring out, okay, why? And that Genova test will show us that. If you want me to look over that and go over that with you, let me know. But yeah, SIBO is, and we were talking about dandelion and other things earlier. There's plenty that you can do for this, and you have testing already. It sounds like they need to know the ALT and AST if that's in response to the liver question. 100%. How to help with bile production. So, obviously, getting the stressors down for one thing, but then to hone in on specificity here, Oregon grape, dandelion root, stomach acid, betaine hydrochloride, things like that. You're gonna do a lot, and you can get even more specific there. But without knowing anemia and certain things that could happen, I'm not gonna I'm not going to be like super surefire of what you want to do there. But yes. Um, okay, back to YouTube. Stop, Gina. Demon Buddy is actually kind of funny though. I guess. Demon, I'm a decent girl. I don't disrespect men. He might be married. Nope, not true. Not true. It might be backwards for you guys, so that's my left hand. Men don't respect low class women. Oh my goodness. What is going on here? Well, Gina, I never tried my. Clark Kent? That's also a new one. Usually it's Evan Peters. That's usually what the. And that one I don't even understand. Clark Kent. Guy. That is, what the heck are we saying here? I don't know. Maybe I'm looking at the wrong person. Oh my goodness. These people are coming at each other's throats. What is going on? Where are you guys from, first of all? I'm here in New Jersey, hanging out. Northern New Jersey. So there's like horses and cows and cool stuff going on here. Oh, look at that. We got Gina's from Europe. We got from Malaysia. Now live in the US. Pretty cool. Don't listen to the haters. I know. There's going to be, no matter what you say, 50% of the people will like what you have to say, 50% won't. You can't please everybody. It's impossible. Okay. Jeez. Or not, we must respect humans. You're not getting into disrespect. Yes, I am from New Jersey. Always been. Actually spent the past 10 years of my life out at school and all these different things. And now we're back. Just opening up a practice here soon. So technically we're open for. Sorry for the TikTokers. Okay, I'll get back to TikTok. We'll come back to YouTube. We had the bio question. We answered that. I went over my stool test, and I have a big son that may have SIBO. We talked about that. No! TikTok, why are you scrolling? Okay, there we go. Bio. I went over my stool test, and I have a big sign. Okay, we went over that. Did you see that video circulating of a black patient treated horribly by an active labor? That is terrible. My answer will always be see your doctor. Tiger Woods, that's actually really funny. I'll just call you Tiger because that's a long name. Hey, Emily, how's your day going? Going pretty well. Today was actually pretty funny, honestly. Message me that idea. Thank you so much for that answer. But yeah, Kayla, message me after this. It's just hard to keep track of a lot of these things. But yes. What's the topic? Health and all things health restoration, my friend. And somebody says, "Hey, Cugine, what's up, man? Cugino, how we doing?" Top in the morning, although it's nighttime. Anxiety is consuming me. Get some California poppy and something like Bacopa so that you can calm things down neurologically, and you can calm down the adrenal response going on there too. Just help them with norepinephrine get down. And but it's really figuring out, okay, well, why is this happening? There can be tons of hormonal reasons why that happens. I would like to see a Dutch test on you, have you figure out some hormonal things that are going on, and that Dutch test is like 8 different pages. it will even show different neurotransmitters and things too. Are pomegranates good to have at night? I mean, I don't have anything against them. I don't have anything against pomegranates, except for they're super annoying to eat. I would go more pomegranate juice because I freaking hate eating all the damn pieces of them. But nothing against it. I don't know if you're asking more about sleep or things like that. What time is it there? It is almost 7:40. Come on, man. Color of food doesn't matter. It just will carry different complexes of sugars, and somebody with overgrowth within the small intestine there is going to have those ferment very quickly, and that's going to expand uh, the the GI under the rib cage. So, Alina, did I answer yours? Oh, cool. Sorry, the new ones are coming up here, and I'm like trying to keep track of everything. Okay, back to YouTube. What the heck? You guys are making me work tonight. Um, where the hell did we leave off? These two are. Did you just say he's from Jersey? We covered that one. I'm from New Jersey, in New Jersey. Boom, boom, boom. What is going on? Has 2,000 light bulbs? You guys are funny, man. That's where the Misfits are from? What's the Misfits? Am I outdated here? American Horror Punk Band. I'm not really, I'm more into like, I'm a freak. I just study, learn things, go on here, help people. I'm a maniac when it comes to that. That is crazy, dude. Can spell. Bum, bum, bum. Gina admit it. Either way, you guys are funny. You guys are funny. I will say that. Either way, fusiform. Um, what does this mean? So, just a type of bacteria there, and you can't really just focus on one bacteria, though. You can't, because there's a whole environment there. There's freaking trillions of damn cells in that GI. So it's like, yeah, or doing some bitters that way is going to help balance things out as a whole, but I want to be specific. I don't want to guess with things. Gina's feisty on here, guys. What is Gina doing? Gina, you're coming for their throats, dude. Relax, guys. There's no hall monitors on this live. Anything goes, brother. Anything goes. Mm. Oh my goodness. Demon. This is wild, bro. This is funny as heck. Okay. You're coming for their throats, putting her scissors down. Good. Put your damn scissors down. There's enough. We could do this. We could commingle. Um, I've never had people come at each other's throats this much. It's weird. Usually, either I'm coming at your throats or you're coming at mine. Okay. Common gut bacteria means nothing. Well, not necessarily, because if something's too much or too little, that's not good. We need things to be balanced. So, did you see my comments? I got a new job. I did. My goodness. What could low alkaline phosphatase mean? My primary doesn't really explain well. Usually deficiencies, and a really common one is zinc. And you should be getting zinc from a an oyster meat that was basically dehydrated and stored properly into a capsule there if you don't feel like eating oysters every day. But zinc, by far one of the top reasons that I see that personally. The gallbladder can be another reason for that. Not enough proteins, another reason. Poor hormonal conversions, another reason. So there's a couple different ones, but all those are valid. I just did the Dutch test, waiting on the results. Oh my goodness. I'm excited for you. Can I be your PA? That's a cool idea. I'm all natural health things though, so I think it would be really cool if you were a nurse practitioner because then you could do all of this stuff and things medically too. So, okay. Um, good. I'm glad you guys are toning it down. He was about to say, I almost said that. So you caught me there. You're quick. You guys are quick. I will say. Um, no hall monitoring, guys. No hall monitoring, please. Just let everybody roam without the about the cabin. Okay, let's keep rolling. We are over an hour in, and we're still going like crazy. Okay, thank you. You're very welcome. I've had anxiety for 4 years now. Blood pressure is normal, but I feel like my heart is racing. Yes, potassium can be deficient. Check your daily intake of salt too, because depending on the weight and size and things, you can take up to 5 grams a day of salt. And obviously, I want you to getting good Celtic sea salt in there, and I want you doing probably some potassium citrate as well. Really common, and I've seen that a ton with COVID vaccination. Just putting it out there how it is. California poppy can be wonderful for you too, but it's figuring out why this is happening in the first place. There can be some things going on chemically there, and then also from an adrenal standpoint or even a mental health standpoint with the GI too. If you were on a ton of antibiotics and now you're having that change for you up there, there's 10,000 nerves that communicate from the gut to the brain. So there's a few different scenarios for fatigue, if I'm saying that correct. Okay. Um, Listen, Gina, I have. Oh my goodness. That is funny. At least we're honest here. At least you're being honest. That's what matters. She used 100,000 lies. Who cares, dude? Oh my goodness. There we go. Look at that, Nas. Nas. That's what we need. That's what we need, Nas. Okay. Does what? Gina, I don't know what the hell is going on here. Okay. Take my words back. Synergy's bad for everyone. I think it's kind of funny though. We're just hanging out. We're kind of through the most of it here. Dr. Antonio, how do we lighten our skin? Um, get no sun. That's kind of the only way I know of. If you want to get a little bit darker, you could do, something like shaga for just more melanocyte type things. That's funny. I just move on to. No apologies needed either. We're just having fun. We're just having a silly goose time. We're in the log cabin. I'm kind of stealing that from one of my favorite comedians, Chris D'Elia. He would basically say, we're all part of the log cabin. gonna be sitting in the tall grass together one day. I think it's a cool image to picture there. Sorry for the words, blah blah blah. Regular YouTube live. That's funny. Well done, us. Yes. How do we become lighter? Snap me out. So I have to avoid embarrassing ourselves. Um, hey, you guys do what you guys want to do, right? Love yourself. Never stop. Yep, yep. Okay. Let's keep rolling. Dealing with a lot of mental health issues and always tired. Lab results are normal. So I want to see them myself because it's it's pretty common to have that come up. But just because that they're normal and within range doesn't mean that they're about to get out of the range. So there is an ideal that we're going for, and maybe we didn't run the right labs because typically I'm just seeing cholesterol panel, sugars, maybe, and like a CBC with a differential, um, which is in terms of what they do, that's what they do. I would want to expand on that to figure out why and why we're having that mental health issue. Just to put this into perspective, 85-ish% of your neurotransmitters are created within the GI. So, it's not a brain issue. But yeah, send me a message there. Ah, crap. TikTok, scroll me to the freaking bottom of the comments again. It's higher than normal range. Psoriatic arthritis and AS. You got to look for things inflammatory wise. I want you cutting out wheat, dairy, corn, soy, processed sugars, getting a food allergy test, getting a Genova test, and probably some blood work here too. But arthritis, itis, got to look for the inflammation and get those responses to calm down. But certainly, certainly. Dizziness, extreme fatigue, brain fog, can't walk very far. Can this be from anxiety? It can. There can be some things with the immune system there too, especially if you can't um, put proper resources into things or you're deficient in terms of immune cells. I would want to for fatia or fati. I don't know. It's FATI. I feel bad because it feels like I'm just saying fatty on there. And that's kind of mean. Fati. I'll try my best there. Send me a message. There's a reason why the anxiety is taking place. There's a reason why blood pressure can't regulate. I typically see yes anxiety things, or somebody that just became cyclic, or a female that is coming off of birth control, or somebody that got a COVID vaccine. So there we go. Okay, back to the YouTubes. Gina is in major denial. Finesse. Ability to avoid arguments. Smile and wave. If there's anything stopping you from loving yourself, praise the Lord, huh? It is true. Look at the comments, turn away. And love House of again. We need God here. Love y'all, God loves y'all. Bum bum bum. Sea cushion merch. I would like to get some merch going. That'd be cool. I want to get funny merch though, like hilarious stuff. That's all I want. I would love to create some merch, but it's got to be funny. So give me some ideas of what could be funny here. Stop it or I'll start trolling again. Oh my goodness. All doctors telling us that we have high cholesterol. Just don't believe them. Well, why is it high? Because I never had high cholesterol before. I was eating the same food and drinks all the time. Yeah, there's people that just eat um, eggs strictly for several months and their cholesterol goes down. It's figuring out why cholesterol's high. So that's a really good question to ask. And I see it more of an inflammatory marker than anything because the body's trying to increase it for a reason. and that's to get healing down. And sorry for, I see you guys doubling up on the questions here. I'm trying to work as quickly as I can. How tall am I? 5'7". Boom, boom, boom. Good night to those. Are a chasm? What is that? Oh, at least you guys are funny. Demon, that is a, that's an idea, right? That's one idea. um, boom, boom. Main problem is soda in my life. I have to stop drinking soda. It's finding out the right forms. It's finding out the right forms. I would do switch to something like Olipop. Olipop is fantastic. Or switch to something like Zevia. Zevia has zero sugar in there. So who else is from New Jersey here? I'm just curious. Where are you guys from? Let me know where you guys are from. Um, Nobody let me know where they're from. Okay, you can do general area. You can do general area. Nas, I know where you're from, or where you're at. I don't know. Whatever. That bacteria is high end. That's why I asked. Oh, okay. Thank you. Just diagnosed with Hashimoto's. So every lab result matters to me. I'm glad that you're basically doing that GI test with the thyroid issues going on because the gut has a huge influence on that. Does he read comments? I do. I just have another live right here. So I'm going back and forth. I'm tackling TikTok right now as fast as we can. Okay, rapid fire. Let's get our last sip of espresso. Let's hit this thing like crazy. All right, here we go. So the Hashimoto's question, yes. Because majority of the time there's an immune system involvement. So I've never seen somebody come in with just low amounts of T4, T3, and I would be curious as to what the thyroid panel was done because you need reverse T3, you need um, T uptake, you need free and total amounts of T3 and T4, obviously TSH and those things too, and then you want to look at antibodies as well. So, you got to be doing more than just that. And the liver has such an influence on this, the gallbladder too, the GI as well. So I'm glad that you ran that. I would want to see that GI test if you want to share it. Somebody says seed oils. Terrible. How should I wrap my ankle before practice? I would ask your athletic trainer. I was an athletic trainer for a while, but yes. Shoot, Emily, let me get back to your question. Wait. Where was it? I think if I beg my doc really, really hard, can I get a hysterectomy? I don't know. I don't know what's been going on there. Baby Brie, night sweats, chills, itchy skin, easy bruising, hair falling out, weight loss, but no answers. Brie, I would be curious as to what labs have been done. And what is your history of viral things that went on in terms of vaccination, in terms of vitamin D levels, in terms of white blood cell counts? Because this makes me think that we have a reactivated virus infection, and now your hair's falling out and your skin's going crazy, and we got to get this. Okay. Had so many blood tests and scans, next is biopsy. What are the chances it won't show on blood work? I lost 24 pounds in 2 weeks without trying. Oh my goodness. One, how's your GI? Are there any symptoms occurring in the GI? And then I would want to see a lot of the blood labs and scans that were done here. And see if there was anything that I do care, guys. I'm reading everything. It's just the painting is almost. You guys said go to the office. Painting is almost done very soon. The office is called the Wellness Way Randolph. So I'll be posting some videos on the before and after, so that'll be pretty cool. But for Baby Bree on here, I am concerned of something with the viral immune system here. Um, if they've ran any viral panels, obviously I want to know some of the white blood cell counts and things like that too, and maybe even looking at an immune panel. But I want to probe some questions about the GI. I want to see what you've tried already, because hearing all this, I love what you've done so far. But what's the game plan now to get back to normal? Um, so yeah, okay, we got to keep the rapid fire going because YouTube's building up, and I got to get a bunch. I'm not going to report anybody. Okay. My daughter gets out of breath just going up the stairs. That's why I'm always worried. Potassium's extremely low. You want to do some potassium citrate. Doctor, I'm doing OMAD. Okay. I would wonder male or female. I was going to practice soon. How should I wrap my ankle? I'd ask your athletic trainer. My son has impetigo. Any suggestions? That is coming from an overgrowth of an infection there. You want to do a Genova test. And I think we talked about him before. Even before that, just do a food allergy test and we'll go from there. Does higher FSH, lower estradiol on the higher TSH labs could be related? They can. Your thyroid and your estrogens interact constantly every single day. But it's now getting a more complete panel of the thyroid there. And I mean, from that, there may be something like a little bit of PCOS going on here. That could be happening. You're not ovulating, not enough of an LH spike. And because of that, you may be ovulating some cysts there, and that has something intertwined with the thyroid as well, because majority of hormonal problems are related to the immune system, and that goes for the thyroid too. Thyroid hormones are hormones. So, also, Doc thinks I have slight insulin resistance. I'm almost 31 and a healthy weight. I would want to ask about stressors there, because stress can just raise things like that alone, and that can affect you a ton. How hard? Med school. I went to grad school, not med school. It can be really hard, but you just got to stick to anything. You could get through anything if you stick to it. Do you think HRT is worth it? I help people not do HRT, so I'm the wrong person to ask. My liver and kidney functions are high as well. Interesting. Oncology thinks lymphoma, but blood work was normal. Interesting. Again, I would wonder what symptoms are current in the GI and what history of viral things that went on. And then we can get an answer there. What's normal DHEA in the blood for a woman? I'd say around 150 to 200. High, what symptoms do you see? High DHEA. Also got the food tests back. Sensitive high to eggs and yeast. So Emma, you got to cut down on your sugars. I would want you to do a little bit of wormwood there. Very little bits, just 1 or 2 bottles of that. Maybe repopulating some of that GI, so doing a good probiotic in there, and probably something like ashwagandha, and maybe a little bit of adrenal glandular in the morning. What happens when you overdose on Tylenol? Oh my goodness. I truly feel crazy because you can't find answers. We got to get more labs done. Whew. Hey, Antonio, how are you? I'm doing good. Symptoms of Epstein-Barr. I still test positive. I had mono 5 years ago. I would be doing a ton of reishi and turkey tail mushrooms like crazy. Baby Bree, how'd I know? Oh, shit. I hit my freaking guang. Baby Bree, how did I know? I've been fully vaccinated and have had mono, reoccurrent pneumonia, and GI issues. I have Crohn's. Baby Bree, we need to do a viral panel. We need to do a Genova test, and that's how we get this back to normal. Look at that. Within freaking 5 minutes. Okay, back to YouTube. Here we go. I saved where we last left off here, so I'm going to go as quickly as I can. Um, does Dr. Antonio care? No. Yes, he does. Yes, he does. I'm not reporting anybody. If you show it. Okay, these people are. Come on, guys. Let's get along. This is YouTube. It is kind of funny. Boom. Probably good. Gina, you cannot be my moderator. You would ban every one of these people. To have a HO. Demon Bunny, you're funny. Nas, don't look at the chat. Continue talking. Yeah, but it gives some time to build up the comments on both of them, so I just go back and forth. So it's funny too. Like I can't just be like super dialed in the whole time, you know. Got to break it up, chop it up a little bit. Doc, don't look at the chat. Gina's mad, guys. Good night, Gina. Okay. Okay, Doc, can I ask you a question? Sure. You guys can ask me any question. The title of the live is Ask Me Health Questions. So, okay, let's go back over here. Let that build up a little bit. Can endocrinologists assist with Hashimoto's? My primary says no, and I don't know who to turn to. Maybe. I don't know. But with Hashimoto's, you're dealing with things hormonally. The thyroid can certainly impact your estrogens as well. But whenever you're dealing with Hashimoto's, it's autoimmunity. So now it's figuring out what are the autoimmune triggers? What is that in regards to food? I think the GI has a lot to offer here too, but you can't rule out mold infections that could take place or even viral infections that can take place that you've not kicked out of your system yet or matured through. So, oh my goodness, there's so many comments that did not filtered out here. But yeah. Okay, it's 8 o'clock. I would love to get through all of the rest of these. Okay, wait. What is one life lesson that you've learned the hard way? That's a really good question. Do not fear. I'll just say that one. Do not fear. That's kind of silly. What the hell are you afraid of? You know. But with the Hashimoto's thing, you have to tend to the immune system. You have to figure out what the immune triggers are, and now these things can return back to normal. Your body's not programmed for disease. Okay. I would want to ask, what's the game plan for your health? And if there's no game plan yet, well, we got to make one. Either way, how do I boost my IGF-1 21 to 22-year-old male? Sprinting, getting your proteins up, resistance training are probably the best one. And then probably some passion flower, which you can hold on to more testosterone that way. And it's really good for post workouts, for helping you rebuild muscle post workouts. Demon is freaking hilarious here. Okay, either way, I am gonna eat some dinner. It's freaking 8 p.m. So for you guys on either TikTok, obviously, if you're on TikTok, send me a message. I'd be happy to go over things with you guys, get to the questions that I didn't answer. Whether it's sending me your labs, I'll give you my email, and we can basically get all that exchange and what we need to do.
I want to hop on the phone even too and ask some more questions, figure out what we need to do a complimentary call to start, and then do consults thereafter. Those are paid visits, but once we have a game plan, things will be very clear. If you're on YouTube, if you go to the channel, you can basically click on the link there. You'll get access to all the other channel or TikTok, whatever. Um, and yeah, Instagram, Facebook, TikTok, YouTube, those main four. I have my email in there as well, so you guys can reach me there. But either way, I'm going to figure out what we're doing for dinner, and yeah, have a good old time there. But that was fun. We went 100 minutes straight, and I got a pee too, so that's fun. But unfortunately, I didn't get to answer every one of you guys, which sucks. But Steven says I don't do TikTok. Really? Everybody does TikTok. But I subscribed. Eat your dinner. Thank you very much. Heck yeah, but reach out, even if it's just to say hey. I'll say hey too. Um, but yeah, good stuff, people. For the TikTokers, see you guys later. Um, and for the YouTubers, it's fun hanging out. You guys were funny. You guys were really funny. But yeah, like check out all this stuff. Um, and yeah, we'll keep chopping it up. We'll be back tomorrow and the next day and the next day and the next day through fruition. But I saw a lot of you guys had channels yourselves, so I'll subscribe to you guys too. So make it even Steven. All right, good stuff. Thanks for hanging out. You guys were freaking hilarious, and we'll be talking tomorrow.